Greetings, I'm Dr. Park Jung-chul of your dental clinic. Today I'll be presenting a case that involved a flapless surgery on the upper jaw utilizing the one guide system. This particular case is a follow-up to a previous situation where I conducted sinus lift via lateral approach on the patient. And now, after 5 months, we're looking into placing implants in that case. Let's look at the image. This is right after lateral approach, and this is before implant placement. This is the patient's initial panoramic view. There is a significant pneumatization in both maxillary sinuses, leaving a limited amount of residual bone. Although there were areas suitable for immediate implant placement, the plan involved lifting the sinus on both sides using lateral approach, and then utilizing guide for immediate implant placement. Lateral approach was done from the upper right. If you look at the pre-surgical CT images, the upper right quadrant exhibited irregularities along the sinus floor, suggesting that the lateral approach would be ideal for the patient. Sinus lift was performed in the upper right. In order to make implant placement more easy, a lot of bone graft materials were used. In this area, a combination of allograft, xenograft, and collagen was used. LCR. This is alloplastic. Alloplastic was used towards the posterior side. The video where I did lateral approach in the upper left is uploaded online, so please refer to it. In number 26 and 27, alloplastic was used, and in the premolar area, allograft, the short os was used, and in the middle, because there was a bit of a space, xenograft was used, and for the bony window area, AOS collagen was used. Lateral approach was performed on both sides of the sinus. The plan was to place implants 5 months later using a guide. This is a CT image taken before surgery. If you take a look, there is sufficient keratinized tissue, and soft tissue condition is not unfavorable. Because it looked okay, flapless surgery was planned. As shown, when there are multiple missing teeth in both sides, you can utilize radiographic guide to get to better interarch relations and utilize it for guide design. You can get more accurate results. That was why I used a radiographic guide to register the arch relations. Guide diagnosis was done number 13, 14, 16, and 17. As for number 15 and 25, because there was not that much of a residual tooth, guide can become mobile. Therefore, guide fixation was necessary. Anchor screw will be used to fixate the guide number 23, 24, 26, and 27. As for number 5, I did not plan to place implant. I plan to use anchor screw. You do not need to place the same number of implants as the number of teeth. If you place the implants too close, the distance between implants can be limited, and the bone level was different from the molar area and the premolar area. If it is difficult to find the right vertical height balance with neighboring implants, then it is better to distance them. Bridge prosthesis can be also a good option. This was the plan. When I looked at the guide design, I did not think that there would be additional need for graft materials. The guide was adapted. It fit well. In order to prevent any mobility, anchor screw was incorporated into the design. Before fixating anchor screw, I do punch first. Removing soft tissue in the area where implant would be placed is normally done. You can do that after fixating anchor screw and applying the guide, but I use punch like a marker to apply the guide. I remove soft tissue first. Guide was applied. I removed the soft tissue where the implant would be placed using punch. Anchor screw was applied to fixate the guide. One guide kit was used and sequential drilling was done, and following the guide, implants were placed. Because a bony width was sufficient and because sinus lift was done sufficiently through previous surgery, there was no problem in doing flapless surgery. ISQ values were favorable. Therefore, one-stage surgery was done. This is post-op panoramic image in number 13, 14, 16, 17, 23, 24, 26, 27. Implants have been placed in the desired positions. On CT, you can see that implants were placed in the desired positions highly accurately. This was about 3.5 months later after implant surgery. Prosthesis treatment was completed. When abutments were connected, ISQ values were all over 70. ISQ values increased compared with the beginning, especially in the area where LCR, a new alloplastic material released from Osstem, was applied. I anticipated results similar to that of other allogenic bone in number 26 and 27. LCR was used as bone graft materials and ISQ values were very favorable in these areas. I thought that this material was of great help in new bone formation. This is intraoral image after treatment, and this is the upper right and left. Prosthodontic stages were done. This is panoramic image taken 7 months later. You can see that graft materials are nicely positioned on CT image, and the bone grafts that were done in the sinus, so you can see that new cortical lining is being formed on CT image. Implant positions and the bone graft materials that were grafted into the sinus are nicely maintained. Please refer to the surgical clip to check out how the surgery was done.
바꿨죠?
네, 바꿨습니다.
하나 더 해줄게. 마지막 한 칸 더 해줄게. 알았지?
네.
하나 더. 이거 볼게. 바깥 줄 알게요.
네.
앞에 밑단이 되게 나와. 하나 더 봐? 하나 더 봐? 됐지?
잠시 넣어주게 해줄게요.
kapıyı. Diyemem. Kapatıyor.
네,